This week on Healthy Living, we look at how nature is good for our health, a natural remedy, experts say. Studies suggest that spending time in green spaces can help prevent heart disease. And New York-based horticultural therapist Gwen Fred highlights the therapeutic benefits of plants and nature. Plus, did you know that indoor plants can improve air quality? Finally, debunking some misinformation about mpox. That's in this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. Did you know that spending time outdoors could greatly improve your mental and physical well-being? That is according to studies in the National Library of Medicine. The experts say nature can help improve our mental health and help decrease our anxiety levels, stress, and feelings of anger. Nature can also help improve our physical wellness by reducing cortisol levels and muscle tension, among other things. Now, a long-term study suggests that spending time in green spaces or by water can help prevent heart disease. VOA's Dora McCoy has more.
City living with limited access to green spaces or bodies of water is bad for your heart, according to a study analysis from Northwestern University's Feinberg School of Medicine.
Participants with limited access to these spaces, particularly those living in a lower economic neighborhoods, right, had higher odds of developing coronary artery calcification.
Coronary artery calcification can be an early sign of heart disease, which can lead to a heart attack. The long-term study found that the association was most pronounced in Black people living in lower-income neighborhoods. On the other hand, access to nature actually has health effects that can slow down the biological aging process.
This beneficial environment also have better oxygen, cleaner air. But I think the most important thing is to promote their social interaction, to be physically active. And all these factors can promote your immune system.
We're going to get a little closer to the water.
The study results come as no surprise to Heidi Schreiber-Pan, a Maryland-based therapist who often conducts client sessions in natural settings.
There's so much evidence to support that when the human body is in connection with the natural world, that our sympathetic nervous system is lower blood pressure. So the body responds so well to the calming environment of the bird song, sound of water, the trees.
The study followed almost 3,000 people for 25 years, from around 1985 until 2011. The study authors concluded that being outdoors often means people are exercising more, which is good for heart health.
Asking yourself that and seeing what comes for you.
That makes perfect sense to Schreiber-Pan.
When humans are outdoors, which is our original habitat, we tend to be more physically active, is what the human body needs. So there's so many cardiovascular benefits to that, just being more active. But then there's also all that other benefit of just the sounds of nature, water and birds, right?
Study author Howe says her analysis provides scientific evidence that it would be beneficial for governments and city planners to find ways to improve access to quality green and blue spaces, especially in economically deprived neighborhoods. Dora McCoy, VOA News, Washington.
Gwen Fred is a horticultural therapist at the Glass Garden at NYU Medical Center and Project Find Senior Center in New York City. She discusses some of the health benefits of nature and how live plants can positively impact our well-being.
I think, first of all, we all learned in science class when we were young that plants clean the air, plants add oxygen to the air, they regulate humidity. But there's a body of research that also proves that being in an environment with plants, a nice area in your town, that it improves pride and a feeling of safety. Therapeutic horticulture is the use of or the engagement of a client, a patient, or a resident in a facility in a nature-based activity that is facilitated by a trained therapist, someone who understands how to use the benefits of nature to their advantage. With any therapeutic relationship, one of the most important things is the rapport and the relationship that the therapist has with the patient, with the person they're working with. So that's first and foremost. And a well trained, educated therapist will know how to attain that relationship, to build that rapport. And once that is there, the practitioner will be able to harness the benefits of nature, the calming, the blood pressure reduction, the heart rate reduction, harness that and design a program or an activity to best meet the needs of their patient. And it could be any patient of any age. The program here at NYU Langone Health, it has been in the hospital in some form since the early 70s. And what we do is we provide horticulture and nature-based activities to our rehabilitation patients. Now, we work alongside physical, occupational, and speech therapists doing co-treatments. And very often that is honing in exactly on the motivation I was talking to you about before. Sometimes it's hard for people to see why they would do something if they're not seeing results quickly enough. And if you can intersperse a nature-based activity where they can see that they're doing something familiar. I think the biggest thing that we can see as a benefit of therapeutic horticulture is the fact that we as healthcare professionals need to treat the whole patient. Humans are not a car where it gets a flat and you fix the flat and the car goes on its way. They are very intertwined. Their mind, their body, all of those things work together. And you have to realize that when you put somebody in a situation where they're in a stressful, maybe life-threatening, maybe something has changed dramatically in their life, and they have to reassess so many things, that being able to incorporate nature into that, to be able to see life around you and see that there's a hope for the future is very important, because it does, as I said before, put things into perspective. Nature is far greater than all of us. It was here before us, and hopefully if we don't screw things up too badly, it will be here after us. And to be able to bring that to people who probably need it the most, people who can't access it on their own, is very important.
Do you believe that indoor plants can improve air quality? And how much do you think having live plants in your home affects your health and well-being? Here are some reactions from Mombasa, Kenya.
I really like nature, so it's very therapeutic. When I wake up in the morning, I see that the green, the color green, I feel relaxed and psyched up for the day.
Currently, I don't have any plant in my house, but I'm planning to get some, include cactus, and among others that could, make the house look beautiful and also add the quality of air in the house.
Yeah, I keep plants in my house for beautification, maybe to improve air condition in my house. Yeah, and some aromas from flowers.
No, I love live plants, but at the moment I don't have any. Yes, due to my work style. But I appreciate the values that the flowers give, especially when you're cleansing your house. Takes the bad carbon dioxide, and then you get the oxygen.
I wish one day, maybe when I own a house, then probably I will keep them.
I mean, it's mom who brought them to the house. And she's a plant mom, so there are a couple of them at the house. I don't think there's a way in which I can know they affect me, but I mean, they make the house look beautiful.
From my knowledge, the little knowledge that I have, plants release oxygen, yeah? So it's true. They do give out fresh air, which is good for the health.
I think it's true. Mostly I've been surrounded by people who have plants in their house, and the quality of air inside is better. And also plants give you that sense of responsibility as a person. No matter how hectic your day is, be like, okay, there's something depending on me for survival. You know, you catering for that plant, watering it. Yeah, I think it can improve mental health.
I believe it's due to some maybe congestion in the house of airs from maybe dust, everything else, but I can get clean air from plants, yeah.
I do believe it, because when you go outdoors, the first thing you smell is the fresh air, the beautiful, crisp air. So yes, I do believe that. I do believe plants clean the environment.
I don't think so. I don't think so. Simple because I think plants are the ones that give us oxygen. So maybe I don't think so.
Experts say indoor plants can improve air quality. According to a 1989 NASA study, houseplants can help improve air quality by removing cancer-causing chemicals like formaldehyde and benzene from the air. Research shows that caring for indoor plants can reduce psychological and physiological stress. Keeping live plants inside the house can improve focus, decrease depressive moods, and improve feelings of well-being. Furthermore, rooms with plants have less dust and mold than rooms without any foliage. Snake plants, spider plants, peace lilies, and ferns are some of the best indoor plants for boosting oxygen levels and purifying the air, according to experts. As the new highly contagious strain of mpox spreads across the world, experts say some skeptics are spreading misinformation.
A new, highly contagious and severe strain of mpox virus, formerly known as monkeypox, is spreading across the globe following a major outbreak in Africa. Clade 1b, a new variant of Clade 1, first reported last September among sex workers in the mining town of Kamituga in the Democratic Republic of Congo, has now mutated, affecting children younger than 15. On August 14th, the World Health Organization and Africa Centers for Disease Control and Prevention declared mpox a global public health emergency for the second time in 2 years, after it spread to Congo's neighboring countries, which had no previous record of mpox cases. Ex-influencer Erica Munga, commonly known as Amarix, accused the WHO of being a criminal organization and asked his 1.9 million followers to shun the safety guidelines it issued. Monkeypox is a scam. Don't comply. Refuse. Pfizer wants to clear its COVID-19 vaccine stocks after people shunned them. Africa's corrupt political establishment wants to divert the boiling Gen Z rebellion. Mpox is another scam by WHO crook. That is false. Mpox has killed 517 and infected 17,000 this year alone, the African CDC reported. COVID-19 vaccines do not apply to mpox prevention. A smallpox genius vaccine, developed by the Danish company Bavarian Nordic, is used to protect against the mpox virus. The mpox virus was discovered in 1958 in a colony of monkeys. The first case of human infection was recorded in 1970 in the Democratic Republic of Congo. While thoroughly false, Amunga's call of no compliance with the WHO mpox recommendations and his portrayal of the vaccine as a scam are part of a viral global trend on X involving thousands of anti-vaxxers and reaching millions of users.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linoch Mudu. Until next time, stay well and strive to make every day a healthy day.